If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, outbreaks of previously unknown viral and other diseases have the potential to inflict serious and massive negative health and economic impact on the world. Now, a new program, a really big idea, is set to start this year, and it looks to stay one step ahead of this situation by identifying viruses in advance. It's called the Global Virome Project, and joining me to discuss it is Chief Scientific Officer with Metabiota, Dr. Eddy Rubin. Dr. Rubin, welcome back to the show, sir.
Okay, very nice being on the show, Robert.
Okay, well, let's start out with a little summary of the Global Virome Project, and can you describe to the audience what the concern is that prompted this effort?
Sure. And so I think probably as your audience is largely aware, we are being confronted with increasing numbers of outbreaks due to population expansion, worldwide travel, interactions with wildlife. Each year we're seeing increasing numbers of outbreaks, SARS, Ebola, Zika. They all illustrate how ill-prepared and extremely vulnerable we are to emerging viral threats. And so the emphasis in the past or up till now has largely been on responding after the event, a reactive approach. And so, you know, this project is really to take a different strategy. It's to take a proactive strategy to begin to understand all the viruses that have potential to jump to humans before they jump. And so we're able to do things to mitigate their potential impact.
Yeah, and one of the problems with being reactive is the fact that, you know, it takes months to get a vaccine ready and other types of reactions. I'm right about that.
Right.
Yeah.
Right.
Now,
yeah.
Now, almost all the recent pandemics are due to zoonotic viruses and it's mentioned as a major focus of this project. Dr. Rubin, how many viruses that infect human are known today? And what are the numbers of the unknown? And what's the goal here?
Sure. And so we know approximately 260 viruses that have jumped from animals to humans. And we, from, you know, studies that have performed looking at viruses in wildlife, we can estimate there are almost 260,000 unknown viruses out there capable of jumping to humans. And so there's an enormous amount of unknown that have the potential to infect us. And so really the goal of this project is to begin to cataloging the unknown. And so it's really a project, a 10-year project to a little bit like the Human Genome Project.
Mm-hmm.
The Human Genome Project was to get all the sequences of the human genome. This project is really aimed at getting a vast majority of the sequences of viruses that exist in wildlife with the potential to jump to humans.
Now,
so it's a big project.
Yes, it really sounds like it. Now, after these viruses are ID'd and they're cataloged, what's the next step?
And so I think this is really where the excitement begins. Virology up to now has been a data poor field. And we know about a few thousand viral sequences. This would produce hundreds of thousands, 1 million viral sequences. And suddenly we're able to approach the problem very differently. For example, right now, we're making vaccines for SARS. Some groups of scientists are working on that. Some groups of scientists are making vaccines for MERS. These are both coronaviruses. Okay, if we had, say, 50,000 coronaviruses, we could then be able to exploit some of the tools of artificial intelligence and deep learning to begin to crawl through these sequences, identify common features where we could make measures aimed at coronaviruses at a family level. And so not only will we be making vaccines for SARS and MERS, but it would also be vaccines for the next coronavirus that may appear in the future. And so it would allow us to proactively prepare for what could be coming to us.
Now, Dr. Rubin, has any of this work been done previously?
Yeah, so this project is really an offshoot of a project that's been funded by the United States Agency for International Development. It's called the PREDICT program. Right. And this has been a viral discovery program which has operated in more than 30 countries, where there have been unbiased surveys of wildlife looking for the presence of viruses in bats and rats and non-human primates. And from that, they've been able to discover viruses, both new ones as well as ones that have already jumped into humans. And so it's really that project really sets the background to say that this is a doable project. We've been able to calculate the numbers of surveys that need to be done to be able to catalog a significant fraction of the viruses in wildlife. And so much of what we have in the Global Virome Project is really an expansion of this project that's already been carried out and shown to be successful.
Right, and you mentioned that this is very doable, but this also sounds like a very costly proposition, both in terms of time and money. Is this a problem for the project? Money is always a problem. And, the Human Genome Project was done 20 years ago. It had a bill of $3 billion, and people were quite critical of it. They thought it was overambitious and it was too expensive, and it turned out to revolutionize medicine. Mm-hmm. And I think in a very similar way, we're costing, the Global Virome Project is costing in the neighborhood of $1.2 billion over 10 years, and it would get us a vast majority of viruses that exist in wildlife that could jump to humans, to give us the tools to begin to proactively respond to that challenge. And so $1.2 billion is an enormously large number. Every time we have an outbreak, we spend tens to hundreds of billions of dollars. Sure. And so just decreasing the impact, in one outbreak, either preventing it or decreasing its, morbidity and mortality, pays for the Global Virome Project. Right. So you're essentially saying there's a really good return on investment for this.
Yeah. And I think, as I said, SARS cost $40 billion. Yeah. Ebola cost $50 billion. And that's just the cost. It's not the morbidity and mortality and large numbers of people in that cost. That's just the economic cost. And so just diminishing that, a tiny fraction pays for this project. Nice. It also pays for the really scary pandemics that we haven't yet seen, but that we fear, and this would prepare us for them.
Right. Now, any final thoughts on the Global Virome Project, Dr. Rubin?
Yeah, and so I think that, we are at increasing risk for outbreaks. We are seeing more and more each year. The changes in population has resulted in greater contact between humans and animals, and there's more opportunity for viral jumping. Transportation now makes it so that what occurred in the Congo no longer stays there, but gets onto takes a bus to an international airport and winds up in London. And so we're seeing that every year. We're seeing more and more outbreaks. Mm-hmm. We need to change our approach. We can't just respond after it occurs. We need audacious and ambitious new ways of thinking about it. And I think the Global Virome Project would provide us the kind of data to respond and use new kinds of tools to respond to the increasing threat of outbreaks.
Yeah, very, very exciting stuff. I want to thank you, Dr. Eddy Rubin, for your time and expertise here. I appreciate it.
Great. Nice talking with you.